Okay, chapter 9, guys. Okay, let me have your attention. Okay, chapitre 9. Chapter, what? Chapter 9. Ooh, I like this. Chapter. All right, chapter 9. Okay? Continuez ces voix, nous m'avons recording là. Okay? For me the PM. Okay. Chapter 9. Okay. Chapter 9 has to do with rehabilitation. Rehabilitation and restorative care. Okay. Now, page 235. What is rehabilitation? Rehabilitation is care that is managed by professionals. C'est un soin qui est managé par des professionnels. It helps to restore a person to his highest possible level of functioning. Li permet que un monde capable de retourner dans niveau de fonctionnement. Okay? It involves a helping resident move from illness, disability, dependence toward health, ability, and dependence. So, li prend moun nan maladie, désabilité et dépendance pour le mener dans la santé, dans habilité avec dans indépendance. Okay? So, it helps to help a resident regain function or recover from illness. So, rehabilitation en fait pour aider un patient pour rejoindre fonction. After surgery, patients spend so much time in bed, they can no longer walk right. Après une opération, patient passe en pile dans la cabane, li vin pa ka marcher, jan te dwe marcher. So therefore, patient may need rehabilitation. Okay? Rehabilitation can be physical therapy. Okay? Now, there's restorative care. Okay? So, they will do rehabilitation for a patient that had a stroke. Yo fè réhabilitation pour un patient qui te fait un stroke, qui perdu, qui perdu habilité pour te marcher. With a stroke, patient lose the ability to walk, so patient will need rehabilitation, physiotherapy. Patient va besoin de réhabilitation avec physiotherapy. Now, restorative care, page 235, usually follows rehabilitation. C'est un soin qui suive réhabilitation. The goal of restorative care is to keep the resident at the level achieved by rehabilitation. But restauratif, là, c'est pour aider patient maintenir accomplissement que t'ai fait dans réhabilitation, dans thérapie. Okay? So basically, here's an example. Physical therapy is rehabilitation. Physical therapy helps you to walk again. Les deux pour retourner apprendre marcher. Restorative therapy help you to continue to walk again so you never go back to not being able to walk. So, physical therapy aide au marcher. Restorative therapy permettre que ou toujours qu'à continuer marcher sans pas faire back en arrière. Okay? So, nursing assistant, at the job they will teach you skills to help the resident walk, to help with physical therapy and restorative therapy. Okay? Dans travail là, yo pral montrer nursing assistant quelques skills, quelques activités pour le faire, tant que range of motion, pour capable aider patient avec thérapie. So physical therapy could teach you more range of motion or ask you to do range of motion for those patients. Guideline. Page 235. Be patient. Prends patience avec gens de résidence. Be patient with them. Be positive and supportive. OK? Faut montrer mon que positif. Ou supporter le progrès que vous voulez faire. Page 236. Focus on small tasks. Recognize that setback can happen, can occur. Be sensitive to the resident needs. Okay? So, aider patient à focus sur petit pas. Bon? Petit avancement. Small task. All right? Give privacy. Encourage independence. All right? So, don't forget your guidelines. C'est la question examen ou sorti. That's where your exam questions come from. Observe and report during the process of rehabilitation. Things can happen. Pendant processus thérapie, réhabilitation ou restorative care là, il y a des bagages qui can changer. Things will change. So you have to observe and report changes, good and bad. Okay? Increase or decrease in ability. Habilité à augmenter ou bien diminuer. Faut rapporter ça. Change in attitude or motivation. Changement d'attitude ou motivation. Change in general health. Changement dans état santé patient. Depression. Ou est patient pas souffert aucune activité. Faut rapporter ça. You see the patient sad. Apathy. Please let me do the class and stop talking. Apathy means the patient lost interest. Ou est patient perdu intérêt. You have to report that to the nurse. Okay? All right. Now, we promote independence. Okay? So, promoting independence. Okay? So, we promote independence. All right? We promote independence. And we also help to improve, we promote independence and exercise. OK? Nous promoter indépendance, nous promoter exercice. Because being independent and doing the exercise will help the patient get better. Lorsque patient a exercé indépendance, il faut que nous encourager lui parce que ça a aidé pour le vite pour le faire mieux. Okay? So, whatever exercise they prescribe, they teach the patient to do, encourage them. Tout exercice où vous avez enseigné patient, ou bien vous avez demandé pour faire pour patient, encouragez-les. Okay? Because when your patient becomes inactive, le patient est inactive, that means they're not doing the exercise. They want to become dependent. Dependent means you voulez dépendre pour faire tout bagay. Here's what can happen, page 36, 236. Dans page 236 là, mais ça qui arrive, le patient pas fait exercice, et puis patient vient dépendant, pas voulu faire rien pour tête. Inactive, not doing the exercise. Inactive is not doing the exercise, not wanting to do anything for themselves. Okay? Loss of self-esteem, depression. So tout ça yo ka arrive. Perte de self-esteem, depression, anxiety, boredom, moun nan senti l'ennuyé, pneumonia, pneumonie ka arrive lorsque patient pas fait exercice. Lack of exercise can cause pneumonia, urinary tract infections, skin breakdown, and the list goes on. Okay? Activity, when your patient is active and is doing exercise. One of the exercises is what we call ambulation. What is ambulation? What does that mean? What is ambulation, class? Walk. Okay? When your patient does not ambulate, okay, and does not move around, does not do any kind of exercise, well, page 236, all of these things can go bad. But when your patient is doing regular ambulation, exercise, and becoming more dependent, le patient a marché, la fait ti exercice, et puis la devenu plus indépendant, ça veut dire la fait plus bagaille pour tête li. Here's what can happen, page 236. It improves the quality and health of the skin. Li améliore qualité et santé peau. Circulation is better. Strength, force patient augmentée. Sleep, relaxation is better. Patient pi bien dormi, li pi bien ka relax, etc. Right? So, one of the exercise, I'm doing a recording. One of the exercise, page 237, is ambulation. Okay? When we say the patient is ambulatory, that means your patient is able to do what? Come on, people. Able to walk. Come on, rive koun ya fò anglais amélioré nan mon. Ou pa ka rive nan fin class sa, pou anglais a still ap tren a tè. Alright? Patient is ambulatory. That's a patient that can get out of bed and walk. Se on pense ki ka soti nan kabon pou fè ti marché. And we need to encourage the patient to walk. Okay? That's why one of the skill of the state exam is to assist the resident to walk from bed to the wheelchair using what? Come on, people. Using a gait belt. Yes. All right? There you go. So, assist the resident to ambulate. That's one of the skill of the state exam. Okay? So, state exam, assist resident to ambulate using a gait belt. We did that skill already, right? Nou te fè skill sa deja, n'est-ce pas? Yes. Very good. So, you need the gait belt, you need the shoes, right? Non-slip shoes, right? And you need your wheelchair, right? Lock the wheelchair, lock the bed, right? Put the patient, lower the bed, so patient foot can touch the floor when they sit down. Descend cabane nan pou pied patient ka touche terre, le chita, right? Gait belt, make it tight, bien serré, check it pou wè s'il serré. Put it on tight, make sure it's tight and check to see it's tight. Test it. Put on the shoes, right? And use proper body mechanic. Don't let the patient hold you around your neck. Pa ki te patient ken pou autour de cou. Have the patient push the bed on the count of 3. 1, 2, 3. Right? When your patient is standing, stabilize patient. Are you okay? Oh, good. Now, turn around, hold the gait belt close to your body, little steps, right? Petit pas, until you get the patient to walk. When your patient finish walking, is on the chair, remove the gait belt, make your patient is comfortable and give them the call light. Right. So, you can go back and watch my video on YouTube. Retournez regarder vidéo sur YouTube. That's one skill to get ready for your state exam. Very good. On page 238, some patient with ambulate will ambulate using cane. Il y a un patient qui marchait en utilisant your cane, your bâton, right? Now, there's so the cane. You need to know what a quad cane is. Okay? Quad cane, li gen 4 points en caoutchouc. We call it 4 rubber tip. Okay? It has 4 rubber tipped feet. That's what they call it. Li gen 4 points. Page 238. Okay? Quad cane. When souffle, quad cane paraît dans examen l'état. That's one skill, that's one thing that shows up on the knowledge test. Quad cane. Okay? Now, there's also what we call the C cane. Okay? Patient uses a C cane. Ou gen patient qui utilise a walker. Some patients use a walker. Okay? There's also what we call a rolling walker. All right, now, so ambulation, quad cane, C cane, walker, rolling walker, crutches, right? All right. So now, guidelines, another guideline now. Let's go to the guideline. Okay? You ready? Page 239. Guideline. Make sure walker or cane is in good condition. Following en bonne condition. That means the quad cane, all 4 tips have the rubber. Pour quad cane, chaque point qui touche terre gagne caoutchouc en bali. Okay? Also, make sure that resident is wearing securely fastened non-skid shoes before ambulation. Faut pas se gen bon soulier dans pied avant le marcher. Okay? Number 3, page 239. Walker should be on the resident's strong side. Eba qui fort là qui pour qu'un be walker. Okay? Number 4. Walker or cane should be 6 inches, should be placed 6 inches in front of the resident. Fok walker ou bien que nan 6 pouces devant patient et la marché. Soulier 6 pouces là. Underline 6 inches. Avec nous m'a parlé, oui, soulier, underline 6 inches. I'm telling you that's important information. Page 239. It should be no more than 6 inches in front of the resident. 239, mama. Right here, 239. On a one page là, mama. Should be, there you go. All right. Number 5, stay near the resident on the weaker side. Okay? Important. Number 5, stay near the resident. Ete prêt, patient, mais copé nan ki bo, nan bo ki faible. Yes, stay on the weaker side. Your resident should be wearing a gait belt. For patient lan gen ki sa? Gait belt. Very good. Next, I'm back here about hang purse or whatnot. But the height, hauteur cane nan doit ajuster à hauteur patient. The height of the cane must be adjusted to the patient's height. who does the adjustment? The nurse. The nurse will adjust the height of the cane or the walker or the crutches for the patient. Bon di la bon créole pour bien comprendre. Si cane nan hauteur patient avec hauteur cane nan doit ajuster pour hauteur patient. Si elle pas normal, elle rapporter sa banne ça pour lui ajuster hauteur cane nan à hauteur patient. Does that make sense? Very good. I don't have a cane here, but I would show you. Okay? So the nurse adjusts the cane, a height. Okay? C'est nurse là qui a ajusté hauteur cane là, ou hauteur crutches là pour patient. Okay? Very good. Now, assisting a resident with ambulation. Assisting with ambulation for a resident using a cane, walker, or crutches. À côté de ça, écrit YouTube pour moi, s'il vous plaît. Right next to that, write YouTube. Because I want you to see multiple videos of this happen. Nous avons vu plusieurs vidéos de moun qui fait patient marcher avec un cane. Okay? So your patient is walking with a cane. Number one, gait belt. Yes. Right? Number two, crutches or cane, height must be adjusted. Ajuster hauteur là. Who does that? Qui est-ce qui ajuste hauteur là? The nurse adjusts the height. Okay? Strong side holds the cane. Et bois qui fort là qui kembe cane là. The CNA stands on the weak side. Comment c'est bon réponse en anglais? The CNA stands on the weak side. Give me my answers in English. Thank you. All right. So the strong side holds the cane. You stand on the weak side. Your patient is wearing a gait belt. You don't stand far from the patient. You stay close to the patient. You're holding on to the on the weak side, and the strong side is leading. The cane should be how many inches in front of the patient? 6 inches. Good for you guys. Come on, it's okay. Give it to yourself. Great job. Great job. Okay. Very good. Page 240. Okay. Page 240. Assistive device. Okay, now on the state exam, they could ask you about assistive devices. Sometimes we call them adaptive devices. Things that they create to help the patient become more independent in performing activities of daily living. Assistive device ou assistive device ou bien adaptive device, c'est des choses que vous créez pour aider patients à venir plus indépendants dans la performance activity of daily living. Okay? So, page 241, you can see them. Dans page 241, où est liste là, pas vrai? You see fork with handles that's curved. Ou est fourchette avec manche là qui courbée. You see a cup, we call it a nosy cup. Ou est un cup, you coupé en partie là-dedans pour n'impatient pas bloquer. Okay? You see spoon with handles that wraps around the arm. Ou est cuillère avec manche là qui marconne autour de main. Things to comb. You see comb with long handles. Ou est épin qui a un manche qui très long et qui courbé. Right? So we call these assistive or adaptive devices. No la?
Yeah.
Very good. Very good. Now, sometimes we could call them supportive devices. Okay? Like walker, cane, things that help the patient become more independent. Safety bar. OK? Tout ça des choses que vous créez pour passer à cabine puis indépendant. What is that? That is, so that's a bedside commode. Commode. So patient can just get out of bed and sit. All of that is assistive, adaptive, or supportive devices. Okay? All right. Now, they even use pillows, body pillows. Gen de zorye ki tout longueur corps. Body pillow to help the patient keep good body alignment. Pour aider patient à maintenir bon aliment le coucher sous cabane. Okay? All right? Now, these things are very important, especially if you have patients that have had an amputation. Page 241. Okay? Amputation, ça c'est un patient yo amputé, yo coupé un membre par voie d'opération. Ou bien un accident fait ça. An amputation can be surgically or through an accident you lose an arm or a leg. Okay? Now, when your patient had an amputation, they may feel what we call phantom sensation, sensation de fantôme, c'est-à-dire, that means patient feel in that area that's absent. Patient gen sensation nan membre qui absent. And sometimes they will have what we call phantom pain. Douleur nan branche qui manque. Okay? So, you must treat any complaint of pain as if it is real. Okay? Toute complainte de sensation ou de douleur que patient reporté, est réel. Okay? Any sensation, any pain that the patient complain of is real and you must report it. They're not imagining it. Et pas un bagay yo ap imagine que yo ap créé, mais douleur la li réel. Okay? Now, page 242, they create what we call prosthesis. A prosthesis is a device that replaces the part that is missing. C'est un matériel que vous créez pour remplacer partie qui manquait. For example, they create a fake leg or a leg in wood. You create un pied en bois or in steel or rubber to help the patient walk. We call that prosthesis. You may have patients like that. Ou ka gen un genre de patient comme ça. So you need to remember that you can go back to your book to review the guidelines. For songer qu'on ka retourner dans le livre là pour aller étudier, pour aller regarder guidelines for caring for amputation and prosthesis care. Et ça faut pas qu'à faire cadeau livre là ni vendre ni. You need to keep your book. Don't give your book. Don't donate your book. Keep your book. Your book is part of your story. Livre la fait partie de histoire bâti là. And later on, it will become part of your history. Plus tard, livre ça a fait partie de l'histoire parce que dans le passé, mais quand tu as étudié. Mais ça t'apprend. And then you can teach your kids, look, I went back to school. I became a CNA. I want you to go to school and be better. Ou ka rale histoire pour dire ti moun nan, m'te CNA, mais maintenant qui livre m't'a étudié, mais ou même m't'a remen pour nurse, m't'a remen pour médecin. Okay? Ou avocat, right? So the guideline will go over, the guideline says, be supportive. Supporter patient qui gagne prosthesis là, qui te fait imputation. Montre très compréhensif, be understanding, help with ADL care, okay? Don't try to fix the prosthesis. They have specialists for that. Pas essayer de fixer s'il gâté. Il y a un spécialiste pour ça. Okay? All right. Now, range of motion. That's part of the rehabilitation process and restorative process. Range of motion fait partie de processus réhabilitation. Range of motion. Range of motion. This is exercise that makes you move the joints. C'est une série d'exercices qui permettent que vous capable de move joint là, jointure. Okay? So, you need to know what is active range of motion. Active, c'est patient qui fait pour compte. The patient does it themselves. Passive, you do it for the patient. Active, assisted, you help the patient. Patient can do it, but you help the patient. Active, assisted. Okay? So, what are some of the range of motion exercises? Page 243. 243. Now, page 243, get up your appeal. They are a lot. Okay? All right? There's a lot of range of motion. There's abduction. Right? And then adduction. And you can do that with all the joints. With some of the joints. Flexion. Extension. Right? Flexion, extension. There's pronation. Supination. It's in the book. You don't have to write it. Supination. There's opposition. Right? The list is big. Right? There's rotation. Dorsiflexion. Okay? Dorsiflexion. Pronation, supination, rotation, flexion, extension. Okay? So, assisting with range of motion. So, you can put YouTube next to that because the list is long. Okay? Now, so range of motion, let me give you some principles. Okay? Range of motion, you have to do it at least au moins 3 fois. At least 3 times. Ask patient about pain. Mandez patient s'il y a douleur. Ask patient about pain. Do not go beyond the point of resistance. Pas aller au-delà de point de résistance. Nou la? Do not go beyond the point of resistance. Be gentle. Be gentle and smooth. Be gentle. Allez souple. Okay? During the state exam, you must say it as you do it. Pendant à faire là, say it. Okay? Dis-le pendant à faire là. Okay? So, flexion, extension. Flexion. And are you in pain? Do you have any pain? Very good. One more time. We're going to do flexion, extension. Okay, now I'm going to do another exercise. It's abduction, adduction, abduction. Do you have any pain? Abduction, adduction with the fingers. Opposition at least 3 times. So the thumb touch each fingers at least 3 times. All right? Opposition. Do you have any pain? You would do this for the patient that has arthritis. With range of motion, you have to use both hands. Faut utiliser tous les deux mains. Support the resident's limb. Okay? Support resident limb. Supporter bras patient. Supporter poignette là ou bien pied. With 2 hands. Okay? Support the resident's limb with 2 hands. Okay? So page 244, 245, 246, and 247, all of that is range of motion. Range of motion, you start from the top and you go down from there, okay? Range of motion, start from the head. Commencez dans tête là pour descendre. Head down. Okay? Up until you get to the feet. Okay? As you perform all the exercises. And finally, bladder training. We have patients that are incontinent. Nous gagnons un patient qui est incontinent. Okay? Incontinent means that the patient cannot hold it. Incontinent patient has to pee but cannot hold the urine. Incontinent. Patient has to poop but cannot hold it. Quiet, I'm doing a recording. Incontinent of bladder. Ça veut dire pas qu'un bébé they can't hold the urine. Incontinent of bowel. Patient cannot hold the bowel movement. Okay? So, guidelines. Guideline page 247. Follow standard precaution. Wash your hands, wear gloves. Okay? Number 2, explain the training schedule. Okay? So, souligner le mot schedule. Underline the word schedule because for bladder training, you need to develop a schedule. Keep a record. So the schedule is a record. C'est un record documenté de chaque fois passé en pipi. It's a documented record of every time the patient has a urine episode or a bowel episode. Offer bedpan, trips to the bathroom, encourage the resident to drink, page 248. On allait dans 248 là. Encourage your resident to drink fluid. Encouragez patient pour le boire. Okay? Encourage resident to eat food that's high in fiber. Insert light, privacy, etc. Okay? So, this is it for chapter 9, guys. Alright? Make sure you study and look for chapter 9 on YouTube. It's gonna become more available soon. Okay? Merci en pile parce que t'es là. N'a cherché chapitre 9 là sur YouTube. Okay? Let me do quickly the attendance. Thank you, thank you, thank you.